with these spontaneous volunteers are that you don't know who they are, you don't know their professional credentials, you don't know if they really are a nurse, if they really are a doctor, if they have any issues on their license, if anything like that. So those are some of the things that come up when you have spontaneous volunteers. Also, you have volunteers that, these type of volunteers aren't well organized and they have no real knowledge of ICS. And ICS is Incident Command Systems. Has anybody ever heard of that? That's like a military command structure, communication, how you communicate in the event of a disaster. And it tells you who's in charge and how everything else breaks down and who to report to. You know, and that's one thing that if you become a MRC volunteer, that's one thing that you have to have knowledge of. We'll ask you to take at least 3 of those courses, and they're online, so you can take them at your own pace. And then liability issues. Who is going to be responsible for the volunteers if they get hurt? So those are some of the things that come up when you have unaffiliated volunteers. The National MRC's mission is to improve the health and safety of communities across the country by organizing and utilizing public health, medical, and other volunteers. So even though the name says Medical Reserve Corps, it's just not medical professionals that we call on, because in the event of a disaster, you're going to need a whole lot more people than just medical people. You're going to need people who know how to put up tents. You need people who know how to organize logistically, try to figure out what kind of supplies are needed, those types of things. So you're going to need a whole lot of people to help in the event of a disaster. Currently, we have 936 units nationwide and approximately 209,665 volunteers. So, and this, in South Carolina, MRC has been up for probably about 3 years. So it's still pretty new. It's still trying to catch on a little bit with the health departments and things like that. So, and it's headquartered out of the Office of the U.S. Surgeon General in Rockville, Maryland. Now, Region 3 MRC's mission is not a whole lot different. We've already gone over the counties. The main thing about our mission is local. We try to focus locally on the community. We don't go outside of those regions unless we are called upon. So MRC, Region 3 MRC focuses on local events and local disasters. But there is a program, a federal deployment program that you go for training, and if there was a federal disaster, then they could possibly call on local volunteers to come help, say in Washington or wherever there's an event happening that they might need other volunteers. Okay. Now the trivia question, who can tell me what an SUV is? Very good. Who can tell me one issue that might come up with a SUV, a spontaneous unaffiliated volunteer?
Don't really know who they are.
Say that again?
So you don't really know who they are.
Yeah.
You can't prove.
Yeah, you have no way of knowing their credentials, really. So those are some of the things that come up. All right, this is how Region 3 MRC volunteers break down. And as you can see, I don't think my mouse, does my mouse work? Yeah. Nurses make up a lot of our numbers. Nurses and then non-public health, non-medical make up a lot of our numbers. So our numbers right now are at 181. And we need more mental health professionals, because I think in the event of a disaster, you're gonna need, people are gonna have trauma. So we recruit to them as well, but it's a voluntary program, so you sign up if you want, you sign up if you don't want. You know, I mean, you don't sign up, so that's just how it breaks down.
It's nice that vets are in there too. That's a population that's often overlooked.
Yeah, yeah. And I was working on a training for how to take care of pets in a disaster. Some people just don't know what to do with their pets in a disaster, or strays or things like that. So
I'd also like to interject that as nursing students, we're not precluded from doing things. I mean, we're limited as obviously from nursing practice, but there's other things that we're able to do to help in the Reserve Corps in the meantime while we're still students.
And there are things that, like Matt knows, when you show up to an event, you may not be doing nursing things. There are going to be other things that need to be done. You might be fixing food. You might be helping put up a tent. I mean, when you come out there, it's just whatever you need to do. I mean, it's like, you know, when you go to Haiti to help out during a hurricane, you might not always be doing medical services. You might do whatever needs to be done at that point. So that's the same for Medical Reserve Corps and disaster events as well. Who can volunteer? Pretty much anybody. Social workers, health professionals, admin specialists, interpreters. We don't have a lot of interpreters. We have interpreters through DHEC, but we don't have a lot of volunteer interpreters. So that's another population that we need to kind of look at, because you're going to have people that come that don't speak English. English is not their first language, so you're probably going to need some help with translating. Medical students, educators, HOSA students, they would have to get permission from their parents, but they can also help. So pretty much anyone. We wouldn't turn anyone away. MRC core competencies. There are some things that you should be able to know, or you should know as an MRC volunteer. I'm not going to read through all of these, but some of them are, at a minimum, you should have a plan of your own, a disaster preparedness plan of your own with your family. Something as simple as saying, if a disaster were to happen, and if you or your husband or wife or other family member are in 2 different places, where are you going to meet? If something happens, where are you going to meet? Have a location of where to go to. If you have a child that's in school, who's going to pick up little Johnny? Is it going to be me? Is it going to be you? Or whatever. So having those types of things in place. And also understanding the chain of command, as I said, the ICS, how that works. And knowing what your limits are. If you know you can't help out in a special medical needs shelter, knowing that if you're called on, you say, I can't do that. You know, if you're not comfortable giving shots, don't sign up to give a shot. So just knowing what your limits are. How do we use volunteers? We use volunteers in several different ways. Health fairs, exercises. What we had on Saturday was an exercise/event, because we were trying to test how the system would work with giving flu a drive-through, with holding a drive-through flu clinic. So we were testing it at the same time. We were actually giving out real vaccine, and we gave about over 200 vaccines. We didn't know exactly how well it was going to go, but it went better than we thought it would. For everybody to stand out there in the cold. Y'all know how cold it was on Saturday? They told me to go home. They told me I didn't need to be out there. I came and they told me to go home. I tried to stay out there, but they didn't.
And the general concept was, I mean, people basically drove through the fairgrounds, stopped at one station, filled out some paperwork, and then drove on to an enclosed tent that they could drive their vehicle in. They stick their arm out the window. And
it was free. So free always works. You know, and it always gets people out. So we didn't expect as many people to come, but I guess free work. So.
And if it hadn't been so cold, it probably would have been even a lot busier.
Exactly. Dispensing medication, staffing shelters. DHEC works with special medical